Port health is an important entity because it plays a big role in protection, prevention, and reducing the spread of infectious disease from one place or from one country to another. We know where people are coming from by using passenger manifest, but also we are using this passport control from the airline. According to International Health Regulation 2005, nowadays we are doing surveillance. In the previous, we were doing quarantine. By surveillance, we get this information prior. This passenger are filling this surveillance form while on board, and they submit to Port Health before the passenger are going for immigration control. Then we do the sanitization, the hand sanitizer. Then we check for yellow fever vaccination.
Hotel Services Unit has a mandate to work through officers who are deployed at points of entry to protect transmission of diseases that can be communicated through trade and travel. So, and that's why we have our officers stationed strategically at entry points at the airports to be able to screen passengers who are coming from areas that have been affected by these infectious diseases, so that we are able to detect them early in time for management so that we secure the public health.
We have two levels of screening for entry of passengers. One, we have the high-risk gate for any pandemic that occurs. Then we have another level for the endemic diseases that we do. All those passengers that are coming from the pandemic areas and its neighboring countries or neighboring states, all those flights passengers pass through the high-risk gate. We do three procedures: temperature measurement, visual examination of the passenger as he comes in to meet the officer. Then number three, we also do this surveillance tool, which is a surveillance form, which they fill, they do a personal declaration, and give information as part of the surveillance form. From the assessment of the three, if you qualify for the three, you are allowed to come in.
We have the crossing point, which is now the one-stop border post, but the rest of the border is just open. So it is actually possible that people will cross. Goods or small trucks will be able to move across the border without detection in some instances. Having a field simulation exercise at the port of entry is important because this is a common area of crossing for both persons leaving one country entering another, and also for cargo. So it is critical that at the point of entry we are able to deal with any cases of outbreaks that may be reported. We receive 100 on average trucks per day laden with cargo. We also release about the same number every day into Kenya. That is traffic flowing from Tanzania into Kenya. The traffic for cargo flowing from Kenya into Tanzania is a bit lower, an average of about 30 every single day. Majority of the live animals that cross from Tanzania into Kenya through Namanga is the goats. We do not have cases of cattle crossing, at least not officially, through the border.
We tested this scenario. Maasai are coming with a truck. They have sheep on the truck, but they do not have the necessary papers. They want to cross from Kenya and sell them in Tanzania. So now they don't have the papers and they just try to get around. You know, there are panya routes. So the police is catching up on them and is getting them back to the border post and making sure that these animals get the necessary papers, that it is made sure that they have no diseases that are now being transmitted from Kenya to Tanzania.
One of the scenarios involved a driver who was coming with a tour van, and he had other passengers in the van. So we responded by giving them health services. So in the scenario that we were handling, those who are involved in trade, in the trade of meat and meat products, should ensure that they only get the animals slaughtered in gazetted slaughterhouses where they will be issued with relevant documents. So as a health officer, my interest is to protect the country from any threat of any impending public health emergency, but we also need to promote trade. So our mandate is to give information to the relevant authorities like trade so that they can put relevant measures to sensitize the community whenever there are outbreaks and put measures that will mitigate further spread, but at the same time do not inhibit trade.
We realized that when you work at the border, we have several agencies who are involved in the border clearance process. The best way to coordinate these border agencies is through the Border Management Committee, to exchange notes and to compare what action has been taken on the other side and what action has been taken on this side, and also to assess the impact on trade and on movement of persons.
I participated in a number of planning meetings from last year that saw fruition of the exercise, and I think it was a nice experience. The most important lesson is that we need to be prepared all the time, because you are expected to demonstrate professionalism when you are responding to these emergencies, such that you are secure and you also secure the public health. We feel better placed to respond. But again, also, as a takeaway is that we need to continually reorient and train our workforce such that they are prepared to detect some of these events in good time for response to secure the public health. Yes, we need to work closely with our counterparts, including the Kilimanjaro, by sharing information, because information is power. If we have information in good time, then we can be able to prevent some of these public health threats.
These kind of exercises need to be undertaken more frequently so that we keep checking the systems that we have in place, because times change, diseases change. The more we repeat such kind of exercises, we will be more prepared to deal with any emerging issues should they arise.
What I would recommend is that all agencies need to work as a team, and there is need for proper coordination so that if any organization identifies any product, especially of public health interest, that might pose a threat to the country, then the information needs to be shared as quickly as possible so that quick response is triggered.
It is true. This exercise kind of rightly fell on the shoulders of the people and persons who worked at Namanga. But I think we carried that burden and executed it to the best of our abilities. It was extremely well executed the way we had planned. For me, because I was sitting in the planning committee, I think I'll tick most of the boxes that we met the objectives that we wanted to undertake. But I think most of us are proud of having been part of that historic moment.